Hey, welcome back to the Healthy Living Scottsdale podcast. I'm your host, Coach Zach. I'm here with CJ Hunt, aka Silly C.
Yo.
And sweet as candy, Coach Brandy.
Hi, what's up?
You guys screwed me up. You're sitting in different positions today. I was like, I wanted to go, I usually go this way, but
it was backwards.
Just trying to mess with you.
Messed me up a little bit. All right. How we doing?
Good.
We're back. I'm back.
How are you doing?
Zach is back. Got, newborn baby at home. So I'm doing great. Feel wide awake today. Wide awake. He didn't sleep too well last night. So I don't know if it was the storm or what. But anyway, we'll persevere. I'll tell you what, I'm not going to let it stand in the way of getting a workout in, and neither should you. All right, guys. So today we are talking about training with, I guess, an injury, and then, which we've talked about before, and then training pre and post surgery. And so it does come up a decent amount with our clients. I mean, we typically, like, our clients are typically 40 plus for the most part, I guess, main demographic. I mean, we work with everybody from 10 years old and up, but main chunk of our clients are 40 plus. And at that age, a lot of times they'll have shoulders that start to break down, or knees. With some of our a little bit older clients, we've seen some hip replacements and stuff. So we do see surgery a fair amount. We always have several a year. And what do you think the doctors say? Like, when somebody has to have surgery, the first thing the doctor says is, like, you should just don't work out, just stop. Which that's the reason I hate doctors. No offense if you're a doctor, but I hate you. No. But that's just an easy thing for doctors to say. There's no liability for them. They're basically just saying, like, don't work out. And that's it. The client never even, like, questions it. It's not a, like, well, what can I do? Can I do this? Can I do that? And we have some clients here that thankfully are rebels, right? And they're like, not work out. Are you kidding me? That's not an option. Maybe I'll take a week off after the surgery, but I'm going to continue to train, right? And so, and those clients always fare much, much better in recovery. They don't lose weight. They are, they don't gain weight. Right. They don't lose any of their progress and let anything stand in their way. So wanted to talk about this today because, one, I think there's a different mindset that happens with people when they have to have some sort of surgery. It's a kick in the nads to them. Like, they get kind of like beat down a little bit from that. And then they're also maybe scared, and they're not sure what they should do or who they should listen to, or, are they going to make it worse? There's a lot of doubt, right? And a lot of questions. So, what are your guys' takes on this when somebody is, they got an injury, they're going to have surgery? What should they do?
Well, I mean, first off, doctors are going to be overcautious. Like, they're going to tell you to do nothing. So that's never a good idea to do nothing. I mean, you always can do something. If it's a shoulder injury, you could come in and you could work out lower body for the entire time. Like, we'd have our splits where you can work anterior and posterior, so you could still come in and work out. Like, that's not something that you want to do. But even without that, there's always something that we can switch the exercise to. You don't have to do something that hurts. We've talked about that before. If it hurts, we won't do that, and we can switch to a different exercise or a different position that really will let you continue to work out. Don't stop, because you've built all that progress. Everybody knows when you come back, whether it's over a weekend, whether it's a long weekend or a vacation, it's harder to get back into it, and surgery is even more.
Yeah.
Yeah, I agree. I think it can be frustrating, when you get that news from the doctor that you need to have surgery. It can be frustrating. You can feel like, that all the progress that you made is just going to go down the drain. But I would say, you can still continue to focus on what you can do instead of what you can't do. And, let us know what's going on. We can always work around the injury. We can help to strengthen muscles around the injured area that will help with recovery going into the surgery, and then as you're coming out of the surgery, help with recovery after the surgery. Continuing to strength train will help build your bone density, so that'll help you recover. It'll help build your muscle mass, which will help with recovery and help with just the tissue around the injury in your recovery post surgery. So I think it is a good thing to continue to work out. Like CJ said, we can, modify the workout for you and ensure that we're not aggravating the injury that you have.
Yeah. And I think, there's a lot of different points that I want to make here, but, you look at just kind of the history of post-surgery protocol. Right. And it used to be like they would replace somebody's knee and then that person didn't do anything for 6 weeks. Right. Now it's like they replace somebody's knee and the next day that person starts PT.
Right.
And they're doing the exercises and they're up and moving. And it's because, like you guys talked about you argued about icing and, kind of the different protocol last week on the podcast. And it's like, movement is one of the greatest tools that we have to create a healing environment. And so you look at kind of how history has transformed when it's come to like post-surgery protocol. Just stop and think about that for a minute. Like if you're somebody who's going, well, I got to have surgery. I'm going to be out for, 8 weeks, 12 weeks, who knows? Like I might never work out again. Which that's very likely. Like if you stop, you might go 3 months, 6 months, a year, several years, gain a ton of weight and not work out for that whole period of time. And then you're starting backwards and you will use the surgery as like an excuse for that. But really it wasn't an excuse because like CJ said, you can always work out. Right. But I would just say to that person that's thinking that way, like, no, stop having that negative attitude because one, like that's not necessarily true or at all true. You just have to recognize that like, you want to hit the ground running as quickly as possible. Right. I've had plenty of surgeries. I've never let them stop me from working out. Sure, they've inhibited or changed the way that I've done certain things. So there's only been one time in my life where I've gotten injured and not been able to work out. And it's because I broke my sternum. And it's like, you can't move any weight with any part of your body when you break your sternum without it putting pressure on that. And it was like, okay, I was out for, 4 weeks. And then as soon as I could start, moving again and working out, like I was back at it.
Yeah.
Right. So one, I would say like, look at that. And then two is you want to hit the ground running as quickly as possible. We want to get you moving as quickly as possible. CJ, what you're talking about is like, there's always something we can do. We can always change your workout program up a little bit. And research, I mean, this has been going on for, probably the last 20 or so years. And there's been lots of different names for it. Now kind of like the latest term for it is cross education. But what research through numerous studies have found is that when you train, let's say you have surgery on your right shoulder, if you continue after surgery to train your left shoulder, your right shoulder will not atrophy. It'll stay basically the same, and you'll maintain like the majority of strength in your right shoulder. And it's like scientists are blown away by this, right? It's like a total phenomenon that it can happen, and they can't really explain it outside of the fact that they believe that it's more of your nervous system remembering how to perform these movements and activating that versus the actual muscle tissue that's being worked. But if you think about that, like, why wouldn't I go into the gym and work out my left arm if I'm going to maintain the muscle, the strength in my right arm that I just had surgery on? I'm going to recover way faster. There's going to be less downtime. I'm not going to lose any strength. And oh, by the way, I stay on track with my fitness program.
Right. Plus you're going to feel better because you're still going into the gym, doing your workout, just feeling better overall, along with the benefits of not atrophying like you would if you weren't working out.
Yeah. And is it an all or nothing attitude? Is that kind of the thing that do you think that's the thing that stops people as soon as they get this? They're like, I can't work out anymore.
I think that's one of the things that happens with it. Also, they think that if I work out this side, it's going to get way bigger. It's going to get way stronger.
You're going to look funny.
You're going to have a Popeye olive oil situation. And it's not the case. I mean, it keeps it pretty similar.
Yeah. And I'll say too, I think sometimes, not in every case, but sometimes working out and strength training can, if you get a diagnosis from a doctor and they're telling you that the only way to recover is through surgery, sometimes strength training can improve, and you may be able to prolong or not need the surgery. I know that's been the case for me. A few years ago, I have a hip impingement and was told I have osteoarthritis in my right hip and I would need surgery. Decided to get some PT for a short period of time and then really started strength training around that area. And the pain has not completely gone away, but almost completely gone away, and have gotten much stronger because I've been able to strength train around that injury. So it's supporting, the bones in a different way. And, I don't know that I will ever need surgery if I continue. Yeah.
Right. And that would be like doing proper training before you would go and like get cut open, right? Or get cut on. But that does happen a lot of the time. And I think it's important to remember that not that long ago, they were just doing lobotomies on people, right? Like things change, like we learn, things change. We kind of figure out like there's better ways of doing things a lot of the time. And if you can avoid surgery, great. If you've gone through the correct protocol and you've strength trained and you've done all these things, well, then you know what? Surgery might just be inevitable. You got to do it. That's totally fine, right? I'm not knocking anybody that's in pain and needs to get that corrected. What frustrates me is when somebody is like, well, that's it, I'm done. And it's like, no, you can still, maybe you take a week off, maybe take 2 weeks off max, right? But you can still walk. You can probably, jog, run. You can get on the bike. You can my dad just had his bicep tendon repaired and he's in a sling and he's on the elliptical with one arm going like this. And it's like, he's working out, he's sweating, he's keeping his cardiovascular system in shape. And so you don't have to let that just be it for you. And it's so frustrating. This is one of the things that if you're not a coach, you won't understand. But we invest a lot into our clients, and there's nobody that is a coach that's a true coach that didn't get into it because they love helping people and they love seeing those results in people, right? I've done a lot of job interviews, a lot of coaches, and then like, why are you a coach? And like, I love helping people, right? I want to see these transformations. And that makes sense. It's like a prick in the heart when we've poured all this effort into our clients and we've seen them change so much. And then at the flick of a hat, it's like, okay, I'm done. Like, I'm just going to stop. And we're like, no, you don't have to stop. It's when we talk about the fitness, when we talked about your fitness identity, fitness is not something you do. It's something that you are. none of us would ever stop working out because like for more than a couple weeks because we had surgery. We would find something that we could do that's going to keep us engaged and on track. Right. And for the person that's like, well, I got to go in and get my knee cleaned up, or I got to go in and get, my shoulder cleaned up or whatever. It's like, that's no excuse. That's absolutely no excuse. I will not accept it as an excuse for you to stop working out.
You got to find the excuse to work out, not the excuse to not work out. And
Thank
I think
you,
a lot of people
That's
are looking
right.
for it the opposite way. They want an excuse to
Exactly.
not work out because they think it's hard.
Yeah.
But it's supposed to be hard because hard is going to make you better.
Yeah. And right. It's like they're looking for the excuse. And at the second they get that of like, okay, yeah, my shoulder's injured. It's like, now I don't have to work out anymore.
I'll get a break. Yep. I get a break from it.
Get a break.
And I'll come back. And it's harder when you come back.
Yeah.
It just is.
It's harder and you might not.
Yeah.
Because we see that happen a lot of the time.
Too often.
Yeah. So, I mean, and the research is in, right? Like cold hard facts. It's been studied. It's been shown that you're going to recover faster. You're going to keep your strength. You're going to do better as far as your recovery goes from the surgery if you continue to train. Right now, if you're in a car accident and every bone in your body's broken and you got to lay in bed for the next like 3 months, all right, I'm going to give you a pass on that one. But how often does that really happen?
Right.
So I'm sure there's probably going to be some people that listen to that and they're like, oh, he's talking about me. Right. Because we've had some clients do that and go through that process. And I would just ask yourself, like, are you better off or would you have been better off now that you're back on track? Like, having just stuck with it the whole time.
Right. And we also have had clients that have gone through surgery and continue. We were training someone, that had a boot on post surgery and, she's doing amazing. And people that do come back after surgery and continue to strength train are doing really well.
Yeah. And I know doctors carry a lot of weight. Like they have a lot of authority. People very rarely question what they say. Which I don't think is necessarily a good thing, because like you said, CJ, it's easy. They're always going to err on the side of caution. And I'm not telling anybody what to do, but I would say like, do your own research and have a conversation with yourself and ask, like, we always talk about why, right? I say that like every episode. I feel like we always talk about why. You got to go back to your why. Like, why am I doing the things that I'm doing? What am I trying to accomplish? And if you're somebody that's like, I got 100 pounds to lose, or 20 pounds, you get 20 pounds to lose, like, is stopping because you have this shoulder injury gonna be the thing that's gonna like move you in the right direction, or is it gonna move you in the wrong direction?
It's a good question.
Is it going to support? Yeah. Is it going to support your why? Right. I think also, like I mentioned the mindset portion of it. I think there might also be a component, like people that do work out and they are putting in the effort and they struggle and they're working hard for it, and then maybe their body breaks down on them. That can maybe create some feelings of like, well, what's the point? Like, why am I doing all this when now I'm broken and I have to go get, fixed up? And I think that might be something, right, that can cause somebody to say like, oh yeah, I need a break.
Right.
Or is it worth it? Is it worth it? So, I think too, we obviously our services are not free, right? And so people will look at it a lot of times and say like, well, if I can't work out at my full capacity, then like I'm not getting my money's worth. And I would, CJ,
not the case.
Right.
You're shaking your head, and it's because you're not paying us for a workout.
It's the lifestyle.
You're paying us for the result, right? And if we can get the result and just change what the protocol, what the system looks like to get you there, then that doesn't matter.
Right.
That doesn't matter. So that, I guess, goes back to like that all or nothing mindset too.
Yeah, it's always worth it. And you're going to have a better outcome if you continue to strength train.
Yeah. So, I mean, my advice for people is, train all the way up until the day before your surgery, right? And do modify some things so you're not in pain, you're not creating more damage, right? And then as soon as you possibly can, get moving again, right? And realistically, depending on what surgery you're having, but realistically, that's probably 1 to 2 weeks. Mm-hmm. And obviously, don't sue us, consult with your doctor. We're not giving medical advice, yada, yada, yada. But everybody's got to make their own decision about the thing. But if it were me, I'm getting back to my routine or as close to it as possible with modifications.
Right.
So, I don't know. Do you guys have any? I feel like I've just been ranting this whole time, but this is something that drives me nuts because I don't want people to use this as an excuse. And that's honestly what I feel like it is. And I think there's a lot of different components to it that go into the psyche of people. But it's frustrating. It's frustrating.
It is. Back to the mindset. Focus on what you can do, not what you can't do. And let us know, what the issue is, and we'll help you.
Yeah.
And just stick with it. I mean, there's nothing bad that's going to come out of it, especially if you're not feeling pain from the exercises that you're doing. So, you've got to work, and it's got to be something that you want to do if you want to have a long life. It just is.
Yeah. Go back to your why. Remember your why before you make a decision, right? So, all right, that's all we got for you this week. I can't rant anymore. So thanks for listening, guys. We'll be back with you next week with more great stuff.
Stick to the plan. Don't get banned. Work out like you're a fan.
Thank you so much for listening to the Healthy Living Scottsdale podcast. Do you have a question that you'd like for us to answer live on the podcast? If so, all you need to do is head over to the Apple Podcast app on your iPhone and do 3 simple things. First, leave us a rating and review telling me what you think of the podcast. In that review, ask anything you want related to health, fitness, or nutrition. And if you want a shout out, leave us your Instagram handle or name. That's all you have to do. Then listen to hear your questions answered live on the next Q&A episode.